Good evening, everyone. Welcome to our May webinar. This evening, we will be talking about what to expect from therapy, and I would say change in general, but with a specific emphasis on therapy. And we will discuss whether or not it's better to aim for reduction or stopping picking. So those will be our topics for this evening. I was very happy that this was chosen as a topic because I find that it's quite important because most people that I work with, not all of them, of course, but a good part of them start therapy with very, very high expectations, very frequently unrealistic expectations altogether from themselves and also from what therapy as a form of treatment can offer. And I find that this more often than not actually slows down their progress because frustration sets in very quickly, and the first sign of something going wrong kind of demoralizes them and demotivates them. So hopefully this webinar will help you understand some of the topics that would be useful to reflect on and define so that you can actually create healthy expectations as you try to actually wrestle with skin picking. I will go kind of in a specific order from very more general things to more specific things. And then finally, I will try to provide as concise and as clear an answer to this second half of the title as I can, which is what's realistic to expect, reduction or stopping. So as I go along, as always, you can ask your questions and I will answer all of them. I will have to give you the heads up that this evening's Q&A will not be as long as they sometimes are. Because they get so long, I lose the ability to speak. And to begin with, I sound like a bad imitation of Cher. So after 2.5 hours of the webinar, I usually sound much, much worse. I decided to include one more Q&A session after our promotional webinar, which we have every month, and it's for people who are interested in learning about skin pick and how it works. So it's a very short webinar. It's like 15 to 20 minutes. So I have more time and space for the Q&As there. So in case I don't get your question and you don't want to email it to me, you can join that webinar and we can have like half an hour or even an hour of additional Q&A then. Those webinars usually take place around the end of the month, about 2 weeks from now. So let's just not stall anymore and let's get started. So first, as I said, we'll start with general issues. I will talk about some things that people don't usually take into account once they set their goals for treatment, or issues that they underestimate. But when I say general issues, I mean that most of this you can apply to any kind of psychological change. So even if you struggle with something else, I don't know, in addition to picking, perhaps you struggle with anxiety or you want to deal with stress, even just general personal growth things. So general limitations or ways of changing that need to be taken into account if you're going to create healthy expectations. And when I say healthy expectations, I mean those that you can actually meet and those that will not demotivate you in the first few weeks of treatment. So first, the most general thing that you can think of is what your previous experience with change is. Unless you're 12 or 13, if you're an adult, you probably have some experience with changing. It's kind of inevitable for most of us in life. And the older you get, the more experience you have. And one thing that really never ceases to amaze me is that when people decide to change something, in this case, skin picking, I see that a lot of you are raising your hands. Just please type your question. There's a Q&A button, and just click that and type your questions in. You can type as many questions as you want as we go through this. So one thing that people seem to always leave out is how they usually change. If you struggle with another mental health issue, or you were, I don't know, struggling to introduce another habit or get rid of a habit, that experience tells you exactly how you will change with skin picking. It's not going to be identical, but it is going to be relevant. So when you start creating your expectations for treatment, take a look at other changes that you've made in your life, the big ones, the more difficult ones, the ones that maybe you're also struggling with now. So, how fast is your pace of change? How much resistance do you feel? How often do you backtrack, take a step back? How fast do you progress? What usually stops you? What gives you additional motivation? So, those are all the things that you already have in your experience. So, you don't need anyone to tell you and give you definitive answers to this. You already have this. And if you create expectations for picking without taking this into account, you're really just kind of allowing yourself to eventually be quite frustrated. Um, for example, I just recently had a client who struggled with drug addiction, and after a long time, she overcame that. But then she somehow, it took her maybe 6 or 7 years to be completely clean. And then she somehow decides that 2 months should be more than enough for picking. And she, in our work together, she even frequently compares skin picking to an addiction, but somehow never makes this connection that if it took you that long to deal with this problem, why on earth would it take you only 2 months to get rid of this one? So it's kind of a random determination that's not based on actual experience. So that's the first thing to think about. How fast do you typically change? And what is that process like for you? What are your standard points of resistance? Because we all have certain things that we are good at and things that don't work as well. If you take that into account immediately, not only will you create a more realistic expectations for change, you will also be able to predict those points where you're most likely to relapse or when you're most likely to experience some kind of resistance. So use your previous experience, but don't look at it through the prism of what you desire, like how strongly you desire to get rid of picking. Try to look at it with, I don't know, someone else's eyes. Like, how would your friends describe the way you change? Try to look at it from a little bit of a distance and assess it as objectively as you can. And then start there. Because even with therapy, these patterns of change will still be there. Therapy can accelerate them, but it can only accelerate them up to a point. So you have to know what your basic pattern, what your theory of change is in order to predict correctly how you will change with skin picking. So that's the basic thing and the first thing to ask yourself. It's not as simple as it may sound to figure that one out. So then the second thing that you have to look at is how ready and how willing you are to actually change. Just because you recognize skin picking as a problem, that doesn't mean that you're ready to start working on it. I can tell you 5, 6, 7 more probably things about myself that I want to change and that I see as problems, but it doesn't mean that I'm ready to do that now. It doesn't mean that something that I want to change is very high on my priority list, for example. So just because you identify picking as a problem really doesn't mean that you're in a place in your life where changing is something you're willing to do. So sometimes people will join SkinPick, but when you actually see, and they will join and they will seem very willing and they recognize it's a problem, they will very openly tell you what it feels like, how difficult it is. But then you will see that they respond to your messages once a week or once every 2 weeks. So there's obviously a discrepancy between something that you identify as a problem and the time that you allocate to actually deal with that problem. And it's this discrepancy that tells you that maybe they're not as ready to change. Right? So no one actually says this, or rarely people say that, yes, I'm not writing because I'm not ready to change. Usually they will say, well, there are more important things in life, which is quite fair, but that also implies that at this time you may not be willing to invest more time into dealing with picking, because psychotherapy for anything really is quite intense. Because no matter sort of what your problem is or how seemingly simple or complicated it may be, it always is about your whole personality. You can't do therapy on one limited part of someone's psyche. So all of it is in play. So that also means that it's not enough for you to even be willing to work on picking. It means that you have to be willing to make changes in those areas of your life that picking inhabits, and also areas that may be causing or contributing to increased urges. This is something that is not easy to determine upfront. I have to underline that one, because you have people who really are willing to change, and they will check in every day and write and diligently self-monitor and do all the tasks that you ask them to do. But then once you start identifying those things that contribute to picking, for example, being overworked, suddenly they will backtrack and they will say, yeah, I want picking to be gone, but me being in burnout and insisting that I have to be productive 24/7, that we're not going to touch. And obviously that is not how it works, because if A causes B and only A causes B, you kind of have to deal with A for B not to be there anymore, right? So in that sense, this is a question that you can only answer halfway in the beginning. You can and should be honest where picking is on your list of priorities. If it's not very high, that doesn't mean that you shouldn't join our program or find a therapist. Not at all. It just means that you should expect your progress to be proportional to the time and effort you put into it. That's all. I have clients and have had clients in the past who took their time and worked slowly and stayed in therapy for a very long time and introduced different topics, and we worked on all kinds of issues until basically they sorted out certain things in their life so that picking can then take center stage and then really deal with it. Sometimes therapy is actually quite beneficial in that period, because it keeps you accountable. You have to check in with someone, even if you do that reluctantly, and even if you're not willing to really work. At least you keep that on your radar. So that's also quite legitimate. And I don't want to tell you that you cannot benefit from it. Just know that how much effort and willingness you're ready to put in is usually predictive of how much progress you will make, or at least it's a major factor. This may sound like a simple thing, but if you look deep down, you will find that there probably is a degree of ambivalence towards change, because we all have that. Whatever problem that we have, that problem usually evolved for a reason, and it serves a kind of purpose. So getting rid of that purpose is not always very easy if we don't have something else to do the same thing, right? So those are some important things to consider. Uh, when you work through these, I suggest that if you like to journal, and I know I'm boring you all to death with journaling, but each one of these is actually a very good journaling topic. Just sit there and put whatever comes to your mind on paper, and then take a few days, and then come back to it and read it, and then see what that seems like from a distance of a few days or a week. Because these questions aren't as simple as they may appear. Because whenever someone recognizes that they have a problem, they're always going to tell you, yeah, of course I want to get rid of the problem. So that's a given. But that doesn't mean that they're actually willing to engage with therapy. Another thing to consider is how, even if you have the time and you recognize it as a problem, the question is how motivated you are to change. Or rather, why is it that you want to change? Do you want to change for yourself or for other people? This is quite a frequent conundrum that I see with people. Uh, Roughly speaking, so this is not official statistics, but it seems to me like every third or fourth client that I get, they want to change for something or someone else. So they will say, I have a wedding next year, so I don't want people to see my face, picked for the wedding. Or they will say, my partner is really, whoops, sorry. Or they will say, my partner is really grossed out by my picking, so I want to stop for my partner. This is I guess, if that's the only thing that motivates you to start, by all means start there. But in my experience, it's quite important to carve out a personal reason to change, because changing for others will only take you so far. It's kind of like a social equivalent of this would be shaming people. We can shame people into not saying or doing certain things in public, but shaming actually never changes anyone's mind. What they will do is they will just take that behavior and keep it in their private sphere. And once it's kept in their private sphere, you basically have no more access to it and you can't change it. And the same thing goes for our psyche. Shame can sometimes entice us to find different ways to cover up what's shameful. So what happens in therapy is if shame or pressure from other people to change is what motivates people to change, they will change only to that extent to which people will see it. And then there will be a core of picking remaining, carrying a lot of guilt and a lot of weight, psychologically speaking, but it will no longer be changed because it's not visible, right? So, and it will in turn impact a person's self-worth, and then you get into that negative feedback cycle, and it's very hard to get out of it. So be clear about what motivates you to change. And also consider if you're dealing with some other issues. If so, let's say you struggle with anxiety in addition to picking. These two things can be dealt at once, and in my opinion, it's best to deal with them at once. So, because usually anxiety will be triggering, so if you become more anxious, you're more likely to pick as well, or at least feel the urge to pick. So they're very, very related. And then you can deal with both at the same time. However, sometimes, let's say you struggle with skin picking and, I don't know, borderline personality disorder or bipolar disorder. Those issues take their own toll. And you have to be very clear about how much mental energy you're willing to invest in one or the other and what's more important. It is okay sometimes to leave a problem in place until you deal with something else if you feel like you cannot deal with everything at once. And especially, I see that with people who join SkinPick and then see that, at least in their minds, if a program is for skin picking, that somehow it won't be as intense as, let's say, other forms of therapy. And then they say, sure, I can deal with this and I can deal with, I don't know, my burnout at work and I can deal with my depression all at the same time. And usually doesn't work out because you only have so much energy that you can distribute between all these things. So in that sense, you have to be really very careful about what you will prioritize. I'm not saying that you shouldn't, of course, deal with picking, but it is okay to be honest with oneself and say, maybe now is not the time. I can try to curb it somehow, limit it, deal with it in these minor practical ways, but maybe skin picking is an issue for some other time once these bigger issues are resolved. If you still decide to seek treatment, then I would suggest that you don't expect quick progress, or at least expect progress to go up and down more than it does usually. And it always does. It's just that in these cases, it might be more because there will be times when your resources, mental and emotional ones, will be devoted to other issues. So be very clear about these things, because expecting to get rid of picking very quickly, but at the same time juggling 10 other things, that simply isn't very realistic. And this doesn't say anything bad about you or how capable or intelligent or insightful you are. It's just that we all have limitations. It's as simple as that. It just means being human. There's no shame in that. Then there are certain limitations that come with the form of treatment that you select. I will talk about limitations of therapy here because therapy is what I do, and therapy just so happens to be the most efficient way to deal with BFRBs, more efficient than medication. Therapy, much like medication, is not fast. This seems to, because CBT has been, our program is based on CBT, so I'll start with that one first. Because CBT has been presented as this kind of no-nonsense, quick way of changing, people rightfully so, come to therapy expecting quick change. And then they get bitterly disappointed because therapy simply is not quick. There are no life hacks or shortcuts or easy solutions when it comes to your psyche. You can use practical techniques, and there are many of them that every therapist can teach you, but even they require effort and time and discipline to implement. Because think about it like this. Picking has, if I generalize for a second, at least two layers. One layer would be the habitual layer, so like the act of picking and the fact that it repeats very frequently. So there's that part. Habits are not changed overnight, especially when you've been picking for a while. Picking is already an ingrained habit, so it's your go to, it's the default in certain ways. Even if you have an efficient technique, for that technique to completely replace picking takes a lot of time. So even though you can learn these techniques in a couple of months in therapy, that doesn't mean that you will be able to implement them 100% of the time, or even, I don't know, 60% of the time. Everyone's different there. It depends on the first thing that we talked about, which is how you generally change. It depends on how disciplined you are, how patient with yourself, and so on. But that takes time. And then there's another layer, and that layer is usually, let's say, an emotional or a psychological layer, which is what purpose does my picking serve? What does it do for me? What emotions are associated with it? What am I avoiding when I pick? And in order to reverse those mechanisms, most of which people aren't even conscious of, takes also quite a bit of time. The fact that you may be smart can be helpful to an extent, and the fact you can connect the dots very quickly. But having intellectual insight is really not healing at all. It's just understanding, and that is not the same thing as changing. This happens very, very frequently. I will have many clients who come and say, I can do this really quickly. This is very easy because I'm very smart. I have a very high IQ. I'm well educated. This also happens to be something that a lot of therapists, weirdly enough, do. They will come and say, "Well, I'm a therapist, so I'm very much aware of everything." And I always think I'm also a therapist, but if I need someone's help with something, that usually means that I'm not aware of everything. But because we therapists have this kind of idea that we're, quite emotionally literate, then we expect to change very quickly, right? If you see yourself as an intelligent, capable person, someone who's productive, high achieving, you will expect yourself to be able to just nail this speaking thing very quickly. But psychological insight is really not all it's cracked up to be. The fact that people connect two and two and then have this eureka moment and then leave the therapy room transformed forever, that only exists in movies. I don't know if it ever happens in real life. Insight is quite important, don't get me wrong. I don't want to diminish the importance of insight. But staying on that intellectual level is not going to produce change because your intellect and your conscious mind don't play that big of a role in your overall psychological life. We like to think culturally, even of humans as being these very rational beings. But if you look at how we decide things, what our values are, what we love, what we hate, you'll see there's very little reason and very little logic involved there. When I say logic, I mean some kind of conventional logic. There's always a reason, it's just that it's not necessarily the rational one, right? So psychological insights need to be embodied. This also requires time. For some people, it will be faster. For some, it will be slower. Again, it depends on how you typically change, but it also depends on how willing you are to try different things. We therapists suggest all kinds of absurd exercises and techniques and things that may seem silly on the surface. But if you're willing to try them, you will then, of course, benefit more. This is not always the case. It's, again, very easy to say, yeah, I'll try whatever, and then I'll suggest something like wear gloves for 24 hours, and then the end, which is about as simple an intervention as you can get. And then people say, I can't wear gloves. That's just very uncomfortable. And then I will suggest something else, and they'll say, yeah, but I really don't like that. And then I'll suggest the third thing, and then they'll say, yeah, but it also doesn't seem very convenient. And then I have to be the bad guy and explain that change really isn't comfortable or convenient, because change means doing differently than what we normally do. And when we do differently, it is uncomfortable because it's different. It's not something we're used to. But it's through these kinds of actions that we actually embody those insights. So your willingness to try different things and to expose yourself to discomfort will directly tell you how fast you will change. If you're very reluctant to feel uncomfortable or anxious or distressed, and if you're not willing to expose yourself not to an overwhelming amount of anything, but to a degree of anxiety, you then have to expect to change slowly, because before you can actually make certain big changes in regard to picking, you have to learn how to tolerate discomfort. So that's an additional step that you will have to introduce into your treatment. Again, willingness will determine the steps that you take. So keep that in mind. The process itself, not fast, and it really depends on how you're willing to participate in it. Another thing that you have to keep in mind is that change is not linear. I maybe I've seen one or two clients, but they were more exceptions than they were the rule, where change was a linear process. Usually, it's kind of like a zigzag line. It goes up and down, and you have better days and worse days. Whatever expectations you set for yourself, it's very, 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 very important that you don't judge yourself based on how the process is going. In specifically talking about this, even if you're a person that changes very quickly, you will experience setbacks. There's just no change without failure. Failure is, as I always say, a chance to learn and improve further, but it is kind of inevitable. And this ties into what I was saying recently, which is recently, I mean like 10 minutes ago, that insights need to be embodied. That means that even if something logically seems like it should work, it might actually not work for you. So you have to try it once, twice, three times. You have to try different variations until you find what works. Each of these means failure on sort of these small concrete levels, but it doesn't mean that you're not on track with change, and it doesn't mean that you can't change, and it doesn't even mean that your process of change is slow. It just means that you cannot judge your progress based on those relapses. So expect them in advance. When you start treatment, even if it's something that you do, like a form of self-help, not necessarily psychotherapy, plan for these. Plan to experience them. Because once they arrive, you will be ready and you will know how to deal with them. And at the same time, you will not be surprised. So it will be predictable. It will not feel like failure. And then, of course, you have to expect resistance to change, and you have to expect a degree of frustration. The more you're unwilling to work through your resistance, the longer the change will take. Because if you're waiting for change to be painless, change will quite literally never come. So there's always going to be a little bit of anxiety. When this happens, my warmest suggestion is just share this with your therapist and then talk with them about that. When you catch yourself making excuses about why you shouldn't try something or why something wouldn't work, all these theoretical explanations, that's a point of resistance. Just put a little red flag there. Share it with the person you're working with. If you have a tendency to resist trying new things, then immediately assume that your change will be slower. So now these were the general issues. So now we're going to discuss some specific issues that relate to different aspects of skin picking that will determine how fast you can change. First is time. And here I don't mean how old you are, because in my experience, if you're willing to change, it truly doesn't matter how old you are. I have had and I have clients in treatment who are over 80 years old, and they progress just fine, in some cases faster and better than other people. So age is really irrelevant. Time, however, is relevant. The longer you've been picking, the harder it will be to change it. So if you've been picking for 5 years, and if you've been picking for 25 years, you cannot form the same expectation in terms of how quick the treatment will be, or even what's your outcome and what mileposts you would like to have on your sort of on your way to change. Uh, there are two reasons why. First of all, picking has that habitual aspect to it, and um, think about something that you do every day that's not picking. For example, for me, brushing my teeth. I just can't fall asleep if I don't brush my teeth, or my day just doesn't start right if I don't brush my teeth. It's not because I consciously get up and tell myself now I have to brush your teeth. It's just a bit I've been doing that for a couple of decades, and it just is mechanical. It's natural to me. It's abnormal not to do it, right? So the same thing, of course, just not beneficial for your health, happens to picking. If you've been picking in certain situations or places or in front of people or away from people, whatever your picking pattern is, and if that pattern has been present for a long time, it's not impossible to change it. So I have to emphasize that. It will just take longer. And the second thing is that symptoms in general in psychology become kind of like onions, like they have many layers. And the longer they last, the more layers they have. And if you really want to get rid of a symptom, then you have to peel off all the layers until nothing is left. So if picking becomes, let's say it starts as a way of managing anxiety. You can't tolerate, I don't know, anxiety in high school. I'm making up a story here. But because usually picking starts in adolescence, so you get acne. I don't know, high school gets stressful. You start picking when you become anxious before, I don't know, your finals. Then you go to college and things become more intense and there's more stress because everything is more difficult. So now you pick when you're anxious, but then because there's so much stress in your life, you start picking to alleviate the the feelings of stress that you don't like to be with. So there's another layer. Then maybe you get into a relationship and then maybe you're afraid of being left or rejected or hurt. And then picking expands to that as well. So you start picking then too. So here's another layer. Then at some point you start working and you maybe have colleagues that you don't like, and then that causes a lot of turmoil. So here's another layer. And when picking lasts for a long time, there are many, many, many layers to it. And each layer can perhaps be easy to resolve, but if there's many of them, it still takes time. Some layers are really very difficult to resolve. So in that sense, just one layer might take a little time. So think about that as well. Make a timeline. Just create a timeline from when you started picking up to now, and then try to pinpoint moments when it became more intense, and then try to identify some of these layers. See what they are, and then see how serious and how important these topics are for you. And that will tell you whether your treatment is just, removing a habit, or is it working on something that is emotionally more profound. It's not, you can't have the same expectations of treatment if your picking is focused versus, just one second, I'm sorry, versus if it's automatic. The reason why is that, first of all, when you start learning about picking in therapy, focus picking is much easier to analyze because you know you're doing it and you're fully aware of what's happening. So you can pay attention to your feelings, to your thoughts. You can pay attention to how you reason your way into picking or out of it. But when your picking is mindless or unconscious, then you have double work to do. First, you have to infuse awareness in it. You have to be aware of what's happening. And then you have to analyze it. Because even And you truly need both, and you need both in that particular order. Because even if you somehow intellectually make conclusions based on what you can recall, you still won't be able to apply techniques because you're not aware that you're picking. So how can you possibly stop it if you don't know that you're doing it? So if you're most people, just to be clear, have both types of picking. And then sometimes I like to think of this as a continuum. I don't like to think of these as kind of discrete categories, because sometimes people will experience those moments where picking might start unconsciously, but then there is a degree of awareness that arises, but picking continues in the background, so it's kind of semi-conscious. So think of that as a continuum. But if majority of your picking is on the more automatic side of things, it will take longer. If most of it is focused, that might work in your favor and might help you change a little faster. So that's something to consider. Another thing is where you pick. And to a degree, this ties into what I mentioned about shame earlier. If you pick only when you're alone, change might be more difficult because it's really hard to hold yourself accountable. If you live alone, that also might make it more difficult. We now have support groups for people who join our program, and this is one of the reasons why I really appreciate those support groups, and I think a good deal of our clients appreciate them as well, is precisely because of this. Because you have someone to be accountable to. You have someone to go and speak to once a week. You have a group of people who understand what you're dealing with, but you also have someone who expects you to progress and change because you're all doing the same thing, you're all in the same program, in the same process. So that's quite important. If you don't have anyone to keep you accountable, or if you successfully hide your picking, that may prolong treatment. If you want to circumvent that, you can share about your problem with someone. Ask someone to be your accountability partner. Open up to someone. Just getting rid of the shame can reduce picking, not to mention the other benefits. If your picking sites are easily accessible and your picking is mostly automatic, that will naturally be more difficult to deal with than if your picking is inaccessible. Sometimes, let's say if you work from home, basically any picking site will be accessible. But let's say if you pick the skin on your back and you work in a shared space with other people, that works in your favor because for a good part of the day you can't pick because you can't take your shirt off or like keep your hands glued to your back. So the environment in which picking takes place can either help you change or actually work in the favor of your excoriation disorder. If it's the latter, then change will be slower. If it's the former, you can actually utilize that and make it faster. If you have an underlying dermatological issue, this may make treatment more complicated because it adds another layer. If you have like eczema or psoriasis or any kind of dermatological problem, it is a source of triggers for most people. Or if you just have sensitive skin, acne, anything like that. So in that sense, maybe it would be wise to lower your expectations, but do more and then address both of these issues parallel to one another. I'll say a few words about skin and and the relationship to the skin. Right now, I wasn't sure if that was the next slide. What I see frequently and that slows down the process is when people conflate what they want their skin to be like with skin picking. Not everyone does this, but there are people who will pick their skin to make it smooth because that's their desired goal. They just can't deal with skin that's imperfect. If we can't separate excoriation disorder from wanting to have whatever skin you want to have, then these two remain glued together. And obviously, the more you pick, the worse your skin will be as a consequence. And then that feeds, these two things feed into one another. So think about this. What does it mean for you to have smooth skin if this is something that you strive to have? And then see how much control you actually have of it over that. I I don't know how to say this gently, and I don't want to be rude or anything, but there's only so much control that you can have over what your skin looks like. I'm one of those people who have very sensitive skin, for example, and there's nothing I can do about it. I went to the store around the corner today and I quite literally came back red. And it's not even summer yet. So my skin was always very sensitive, for example. And if I insisted my skin to be a certain way, I think that would have driven me crazy because my skin simply doesn't care what I think. There are certain things that I can do to make my skin better. I don't know, I can have a good skincare routine, but that's all I can do. Everything else is outside of my control. And this distinction is incredibly important to make if you actually want to make progress. So it's never an easy thing to do, but there are certain things that maybe have to be accepted. Some people will have more blackheads than other people. There's nothing you can do about it. It is the way it is, right? There are certain aspects, like some people have oily skin, some people have dry skin. You can use cosmetics to balance that out to a degree, but you don't determine your skin type. There's nothing you can do about that one either. So those are some things that have to be accepted so that treating picking can be efficient. Otherwise, you're making it more difficult on yourself. Because not only do you tie skin picking to something that you cannot control, it also generates a lot of frustration and anxiety, and that in itself is triggering. So you have a multitude of ways in which your skin can trigger you. So when it comes to the skin and predicting and setting expectations for treatment, think in terms of what is it that I can control and what is it that I cannot control. Not what I should be able to control. Because shoulds are complicated, useless, and completely random. There's nothing that you should or shouldn't do. From your experience, what is it that you can control? And that's where you should stop. It doesn't matter what you think that should be. So let's consider some things that might actually, most of what I was talking about here was what can prolong treatment and what can make it difficult to change. Let's consider now, at least briefly, what can actually facilitate change. Those are some, I don't know, characteristics or traits or capacities that you either have or can develop. And if you have them already, good for you, you will change faster. So what can help there? First, patience. Patience, I don't mean that in any kind of weird metaphysical, like new agey way. As you know by now, I'm a very down to earth, banal even person. Patience for me just means acknowledging that things change in a certain way and not faster than that. And that's all it is. So it's like acceptance of your pace of change. This is quite important. To be able to listen to where your boundaries are, to notice what limitations you're facing, and then accept that if it can be altered or accelerated. Here again, it doesn't matter what you think should be or what you should be able to do. What matters is what is, or at least what is for you, to you. That's what counts. The reason why patience is so invaluable is because when you're changing, again, you're venturing into new territories. You're trying lifestyles that you haven't tried before. You're maybe, I don't know, making some painful cuts in your life. You could be introducing replacement habits. All this takes time and it takes learning. So that means that you will fail and get sidetracked. and being patient with yourself and allowing yourself to explore these things at whatever pace your psyche needs, that helps. So if you're generally a patient person, it's very likely that this will help you, that you will change faster as a result. Discipline, so not willpower, but discipline. Discipline is something that you can practice, develop. It's a skill, it's nothing mystical, but it is something that is very helpful precisely because change requires us to do certain things every day or a few times a day, or to intentionally try to recall, remember something, apply something. The way you differentiate between discipline and willpower is that willpower is just this um, brute force, basically, whereas discipline is kind of tied to our values. What drives discipline is wanting to be a kind of a person, whereas willpower is just this massive force that you apply to not be a kind of a person. So discipline is very precise and directed towards a specific goal, a goal that ties into your values, because when something is meaningful, then you're more likely to actually do it. If you remember in the beginning when I was saying how important it is not just to recognize skin picking as a problem, but actually have the desire and to prioritize it properly, this ties into discipline. So discipline is always your ally. If you're disciplined in other areas of your life, that will be an invaluable skill. That will of all these, I think discipline may be number one in my mind in terms of change. So not anyone's intelligence, not the capacity for introspection, but discipline. Because all the introspection in this world is not going to be useful if you're actually not going to put in the work later on. And for that, you need discipline. Self-compassion is a big one, and it's also a rare one. Why it takes place. So first of all, self-compassion is something that would ideally drive a good part of your reasons to change. Self-compassion just means wanting to alleviate your own suffering. Self-compassion and patience, when they're combined together, make up almost a superpower, because when you have a bad day, you will be able to, if you just think of these first three, let's say you have all three and you have a bad day, that means you will be able to take care of yourself properly. You will be able to do what you need to do, and you will be able to see that this is the best way that you can do now without getting upset with yourself. So the capacity to be compassionate to yourself and forgiving, in addition, will help you change. First of all, it will remove a layer of triggers that come from frustration, from anger, from disappointment. When you have self-compassion, all that is neutralized. And it will also help you accept what you can and cannot change. So you will know how to focus your resources. Openness and vulnerability refer more to you, and trust refer to you in your relationship with the therapist that you're working with. If you're having a hard time opening up to the therapist, for whatever reason, that is going to slow down your change. If you're willing to kind of, I don't know, open up to show, all the shameful parts of yourself, or most of them anyway, the pertinent parts of you at least, that will help you change more. Because the more you hide or obfuscate or blur the information about yourself, then your therapist doesn't really have all the proper material to work with. And at the same time, when you're not being open and vulnerable, what you're validating is a lot of shame and a lot of guilt. And guilt is an emotion that wants to keep you in check. Guilt doesn't care about self-improvement. Guilt cares about status quo, because we feel guilty when we step outside of how we see ourselves. When we do something that a person like us, how we see ourselves, should never do. That's when we feel guilt. But if you want to change, that is precisely what you have to do. because changing means being different. So being open and being vulnerable means also peeling away, layers of shame and layers of guilt, and that will immediately help you take a few steps forward. So it'll greatly increase your chances of changing faster. There's trust in your therapist, but also in yourself that you will be able to handle it. And then there's willingness, which means just being able to nudge yourself into trying different things, even when they don't seem like they're very likely to succeed. Being afraid of failure is paradoxically the biggest reason why people don't change. So you have to be willing also to fail. Now the question remains: should we aim towards reducing picking or stopping altogether? I have two answers here, and they complement each other. Don't worry, I'm not going to give you contradictory answers. I don't like, people sometimes talk about BFRBs as chronic conditions. I like to avoid those terms because when people conceptualize something as chronic, that immediately means that they will give up the big goals. They will think about managing, but not about stopping or somehow radically changing themselves. Right? It's like chronic conditions are those that will follow you for the rest of your life. So I don't like to think of, well, honestly, most things in those terms. Uh, I see the same trend, I guess, with certain things like anxiety and depression, where people will say, "Well, I was depressed twice in my life, so I'm just prone to depression." And to me, that is, in a way, self-defeating thinking. So I don't find that a very useful thing. I think having the goal to stop picking completely is a valid goal to have. Like, that's a perfectly valid goal to have. Imagine, let me use a dramatic comparison, but imagine if you were addicted to drugs or drinking. Uh, what would it mean? Let me just use a little less heroin. Would that seem like a reasonable ultimate goal? It would kind of imply that you will use it your entire life. You'll just try to do it a little less. So in that sense, of course, stopping is a valid goal to set. The only question is, how is it that you frame this goal? So I would say that in order to actually stop picking, if that is going to be your ultimate goal, reduction is the way to go. So for me, these are not opposites at all, because reduction is the path to stopping. So I see them as building one on another, not something that you have to choose between. I remember reading this book about meditation. I cannot remember who the author is for the life of me. Doesn't even matter. But in that book, he gives advice to his students. So it's kind of like a dialogue. And he says in that book, whenever you sit down to meditate, so even if it's like your regular morning meditation or whatever, like 5 minutes, between sessions or whatever, he says you should set the goal to attain enlightenment. And I think I would meditate once and never again. Like, it would seem like such an absurdly big goal, even if I were Buddhist and that would, even if that were my ultimate goal, it would seem completely absurd to me that I'm going to say, okay, I have 15 minutes, I'm just going to meditate for that long and I'm just going to achieve enlightenment. To me, that just seems bizarre, to be honest. And as a therapist, I get to see a lot of people changing and I get to understand how their change works. And usually it doesn't work that way. No one says, I'm going to stop picking now, and then they stop picking immediately. There is a group of clients, a minority of clients, that think that reduction is not good for them and who prefer to just stop immediately. I will address that briefly because there is a way to work with that. Although for most of my clients, I suggest reduction, but reduction as something that will lead to ultimately stopping. Because goals have to be useful. So stopping a valid goal, it's a long-term goal, right? And then when you have a long-term goal, what you do is you break it up into smaller goals. And each of these smaller goals should build on the previous one and challenge you a little bit. So incremental change is a more realistic approach for most clients. I say roughly to clients, aim for 10% reduction per week. Or let's say 30% per month, like something that would be reasonable. And then when you plan for that, you also have to plan that on some weeks, things might not go the way you planned because there will be setbacks and there will be relapses. But if you think about it, 10% reduction per week isn't a small goal at all. Like 10% doesn't sound like a big number, but if you think what that means, it means that if you were to follow even that in 3 months, perhaps you wouldn't be picking. So it's not at all a small goal to set. But the reason why I insist on weekly goals and why I insist that they are small goals is so that when you take a small step, that is a step forward. So you're moving towards your goal. So that's good. When you achieve a goal that you set, then you feel validated. Our brains react much better to being validated than they do to being scolded. So small successes, and each of them has to be properly celebrated and properly rewarded. We talked about this, I think, last year when we talked about habit formation, but maybe that if you're interested in learning more about that, we can maybe repeat that webinar and then I can add the feedback that you gave me and build on it a little more. So small goals, attainable goals, and always validate yourself for every little success. Reward yourself somehow. So a rule of thumb, if you need one, challenge yourself, but don't overwhelm yourself. If you overwhelm yourself, you're far more likely to then, on top of failure, experience an even bigger relapse. It'll affect your self-worth, it'll affect your self-esteem, it'll affect your motivation to change. So, small steps. What's not a useful goal? So, as I said, taking a step out of your comfort zone is useful, but going a mile outside of your comfort zone is harmful. So it's not just that it's not going to help you change, it will actually harm you if you set your expectations so high that there's no realistic chance of succeeding. And again, I have to go back to what I said earlier. When we set goals and expectations, it doesn't matter what you think you should be able to do. Just irrelevant. I think I should be able to do a lot of things, and yet I'm really not capable of doing many of them. But this is because shoulds come from this abstract place of thinking, and that's not very useful for psychological change, because we change in real life circumstances. So, small steps. And what's a small step is determined by your previous experience. If until now you were never able to go a week without picking, why on earth would you set a goal to stop picking immediately, or even after a month? Go a day without picking, maybe. Then try 2 days, then 3 days. Don't go 1 day and then 1 week. In terms of incremental changes, that's skipping steps, not very useful. When you set goals out of impatience, then you will ignore the realistic context in which you change, and you will fail. Perfectionists are experts in this. Perfectionists tend to set goals that are so completely devoid of the context in which their lives take place that they basically condemn themselves to failure. Expecting yourself to stop in a specific time frame isn't very useful because it puts undue pressure on yourself. This is something that I see when people say, well, I want to start therapy now because next spring I'm getting married. Seems to be a big one. Marriage for both men and women seem to be not marriage as such, but like the wedding day seems to be a very big motivating factor. I don't find that that's very useful, precisely because change is so meandering and you go left, right, and up and down. It's very hard to say that you will be able to stop until a certain date. And the closer you are to it, the more the pressure rises, then there's more anxiety, and you actually increase your chances of relapse. It's not possible to change while expecting your life to stay the same. This is incredibly important. And what comes to my mind first when I read this is work. People will frequently pick because they're overworked, because they have too much to do, too many responsibilities. They expect too much of themselves, or they're just burned out. We live in a world that doesn't really have a healthy attitude to work, and for some reason, killing yourself doing your job is considered a virtue. And then they connect picking to that, to the fact that they're overworked. And then the natural step is to work less or work differently, or maybe give up on some of your ambitions, or at least give up on the time frame you set for yourself. And then that's where the problems start. And then people say, well, yeah, but I would still, like to work 12 hours a day, 6 days a week, but not to feel the stress. But that's just sometimes not possible because psychotherapy is not magic. And from what I hear from my clients who actually practice witchcraft, magic isn't omnipotent either. So there's some things you can't even do with magic. I was quite surprised by that. Defining a way of changing that doesn't align with your actual experience of change is also not very useful. If you've changed in a certain way 5 times previously, don't expect things to go differently this time around. You can tweak that a little bit, but fundamentally the mechanism will stay the same. So understand it better and then base your expectations off of that. And now, what if people want to just stop? So as I said, for most clients, I don't think this is a realistic or even a desirable approach to change. I mean, even with slow reduction, like those incremental changes that I mentioned, relapses are to be expected. But what happens, I have a small percentage of clients, maybe it's a different percentage for other therapists, I don't know, but for me, it is a small percentage, who come to therapy and say, I'm going to stop picking tomorrow, and that's it, no more picking for me ever again. And sometimes they actually do well for a month, 2 months, 3 months. They can do quite well. And what happens is that they just use enormous amounts of willpower to resist picking. We had a webinar like last month or the month before, I'm blanking out now, about discipline, where I spent a considerable amount of time talking against willpower. And cases like this show why willpower is good to use one day, but it really doesn't lead to any change. It will wane. You will lose your willpower eventually. And then what will happen is that after a temporary improvement, a significant improvement perhaps, you will experience a very strong relapse. Because once you run out of willpower, all the urges will come back with a vengeance. Right? So this is why I don't recommend this. If, however, you prefer this approach, maybe you can try it with a little bit of context. First of all, don't do that from the very start of the treatment. So when you start treatment for skin picking, the first couple of weeks are usually not about making efforts to stop. It is about making efforts to understand your picking. If you keep using your willpower not to pick, to push away the urges, to just power through that, you won't actually be able to understand your picking sufficiently. So if you want to use this approach, then wait until you actually get enough information, coordinate with your therapist, and then try implementing the all or nothing approach, the just stop approach, in specific places. Let's say if you have 3 picking sites, then eliminate one, and on the other 2 try to reduce. And then when you stabilize yourself like that, then take out the second site, but reduce on the third. So try to balance out the approaches. And of course, in either way, however you choose to change, work with relapses. Think in advance that they're going to occur. So in the end, let me try and answer this question as clearly as I can. Is stopping completely realistic? Can you stop actually picking your skin? Yes. Can you stop feeling the urge to pick? No. But again, I would never set stopping a feeling of any kind as the goal of therapy. A feeling is essentially a set of body sensations. And then those body sensations become associated with memories or thoughts, and all of that mess together we call the urge to pick. Some other messes like that we'll call sadness or anger or hunger or being in love or whatever, right? Panic. So that's what feelings are and how they work. I see that a good number of you just raised your hands. So just please type in the question. I believe this is my last slide, and then we'll go to the Q&A in a minute. So I will get to them. So, but when we start treatment, if your therapist doesn't tell you, here I am telling you this now, you can never pick again. That's fine. It may not be easy or quick. It's possible. But no amount of therapy can deprive you of feelings. And if you ask me, no, that should never even be the goal of therapy, because feelings are just very normal for us humans. And you will be human. If you believe in reincarnation, maybe not next time, but this time you're stuck with being human. So it is what it is. The connection between the urge to pick and picking is something that comes from experience. Like you experience something very unpleasant, and at one point you picked, and picking alleviated that unpleasantness, and you made that connection. And then as this cycle keeps repeating over and over again, what you do is you start to look at it as if it were intrinsically connected. But from a constructivist point of view, and you know that this is my preferred way of looking at psychology and humans and the world, feelings of any kind are really just information. The same way that thoughts are information, just expressed with words, feelings are also information, just expressed with different, instead of words, symbols are sensations, right? We had a webinar about that, or even 2 maybe. So one thing that you learn to do in psychotherapy is to understand the urge to pick as being a kind of message. It's your body, your psyche, your unconscious mind, whatever theoretical position you come from, doesn't matter, but that part of you is telling you something. Killing the messenger shouldn't be the goal of therapy. What we do in psychotherapy is learn to decouple picking from the urge, and then we teach clients to relate to the urge differently, to translate it, to decipher it, if you will, to befriend it even. And that goes for all unpleasant feelings. Sadness tells you that you're losing something internal, something external, part of you, an image you have of another person. Guilt tells you you've just made a mistake. You didn't behave as you were supposed to. Shame tells you that others might perceive you differently, right? So unpleasant feelings provide relevant information. Anger means that whatever expectation we had just fell flat. Like that. That's what it means. So what we learn is how to understand these messages differently. So to an extent, can you reduce the urges, make them far and few in between? Absolutely. Can I guarantee you or anyone that you will never feel the urge again in your entire life? Well, no. Likely you will. It's just that you might develop a better relationship to it. I can imagine that before I went through my personal therapy and my training, that I would be resistant to this idea. But having spent many hours in therapy, I mean, not as a therapist, but also as a client, I've learned to appreciate my unpleasant feelings, I will say. So it's not mission impossible. But if your goal is to never again feel the urge, I urge you uh, not to have that goal. Like, don't set that as a goal because you're very likely to fail. Picking, absolutely, you can reduce, you can eliminate, that's fine. But whenever you feel in the future, like once you're done with therapy or personal growth in whatever way you want to do that, even if it's something that you do on your own, the ideally the place that you can get to is a place where you feel the urge and then you understand what the message is. You understand that maybe you need to take a break, that there's something off in your life, something's missing, there's too much of something else. Like that's the way that therapy will teach you to approach the urge. So that's all I have for you. Let me close the poll so that we can see what our topic will be for next month, and then we will go to the Q&A. I will share the results with you if you're interested. Let me just quickly see. So, oh wow, it's like a landslide victory. 55% for boredom as a trigger. What came in second place was stagnating on the path to change. So we'll see, maybe that wins next time. But boredom will be our topic for next month.